with the people from the lower Murray, Coorong, Fleurieu Peninsula areas. I've got connections to the Arawamara people in the Rope River region. And Sarah and I are here to share and learn and come together to, I guess, progress and listen to how we can build upon this very important work. Sarah, did you want to introduce yourself?
So, Ninamani, my name is Sarah Agius, and I just said hello, how are you in Ghana? I'm a Ghana Ngara woman, and I've just started in the program in September. So we would like to acknowledge the Ngara people, traditional owners of this beautiful land that we meet on here today, and like to acknowledge all elders past, present, and emerging.
Today we're here to talk to you about the Maternal Health Tackling Smoking Program delivered out of the Aboriginal Health Council of South Australia. It's funded through the funded through the Drug and Alcohol Services South Australia out of the state government, and it's part of an overarching tackling Indigenous smoking response through AXA. Objectives of the program are, to reduce the prevalence of smoking amongst our women, and also impact and have a positive impact on their families in South Australia, ensuring that our babies get a really good start to life and close the gap. Although there has been positive results in South Australia, we know that there's much work still required, and we've heard lots about it in regards to supporting health professionals to build their confidence and knowledge and skills around the key messages and resources needed to make those positive quit attempts easier for women. Some of the milestones of the program is, we know that there's approximately 1,000 births each year. And in 2010, when it first commenced, the rates were relatively quite high. We know that in 2017 there was a significant reduction, and smoking rates had decreased to 41.3%. So there's a correlation between the campaigns that we were delivering and some of the program elements around the Sticking Up for the Smokes campaign, which we're delivering smoke-free messages and engaging with local ambassadors, community women to really strengthen the messages and promote, their journeys. It's as part of it, and also part of a coordinated approach, as I said, in terms of really supporting women, health services, workforce to make successful attempts for women during pregnancy. I'm going to hand over to Sarah to talk about the elements of the program.
So, to support all the practical stuff, so we talked about a lot of the complexities this morning, and it is our role as Aboriginal project officer or Aboriginal health workers then to take all of that complex information and translate it to something that's really practical and works for our people, which is actually a real challenge within itself. So we try to use lots of strategies to do that, and that's obviously trying to use an empowering, strength-based model and approach and language with culture, all mixed in there to try to get the outcomes that we've been talking about. So we do that through empowering our women. We really do connect with our culture and resilience and strength as Aboriginal women to try to look at the positives and how that supports our behaviour changes in going forward. We definitely tap on looking at colonisation, the history of smoking, the impacts that have had, the science behind cigarettes being that they're designed to addict us and targeting a lot of the time Aboriginal communities as well. So sometimes we sort of try to put it out there, it's a little bit questionable, did we really have a choice to take up the smokes? We work with our member services across South Australia, and we try to support them with their Women's Day groups, and we Marianne Williams, we would like to acknowledge Marianne Williams. So she's had a big role in this project for the last 9 years for her contributions and commitment, and she would deliver PAMP days with the women to engage with them, to have these conversations in a safe place, and that proved to be successful. Yeah, and also in this role, able to do one-to-one brief interventions, follow-up and support. Yep. Did you want to do that? Yep. So what I'm able to do is we are able to work with the AMIC students as well, and try to empower them to about having what role they play in addressing the smokes. And again, some of the things have been confirmed about sometimes their fear of, straining that relationship and having them conversations. So we're trying to work out ways, how do we empower our AMIC workers to have these conversations if they are smokers.
What's AMIC?
Oh, sorry, Aboriginal Maternal Infant Care Workers. Yeah, the training. So at the Aboriginal Health Council of SA, we have an RTO and they provide that training as well. So I'll probably go to Port Augusta and Waiata next week and support and provide education sessions there. Oh, what have we got? Oh, so two-way partnerships. We're trying to look at, really building the partnerships moving forward. I have got about a 4-month work plan, so I've got some high expectations of myself to achieve these things in 4 months because the program ends there. But the TIS team that we work closely with will continue to support women and pregnant women going forward.
If I can just add, the difference between the DASA funded program that Sarah's working within day to day and TIS is that Sarah has a really strong focus on being able to provide that one-on-one intervention and follow-up, whereas the TIS program is a lot broader, has a different role.
Yeah, but we're very complementary. So, talking about prevention, we've got the youth worker in there, and we've got other workers that go out and work with the workforce and organisation. So having that whole systematic approach of working at the community, at the workforce level, and then the community level, taking all of those things into consideration, we try to do, and support each other in that way. And obviously trying to add language in there where possible, and also talking about the effects that it's not just in the womb, but it does lead into childhood and even adulthood, the effects of smoking. Go on to the next one. Did you want to talk about the... so throughout the program, Mary-Ann Williams, who was leading it for the last 9 years, she implemented a 2-phase comprehensive statewide social marketing campaign. The 2 campaigns was, the first one, Sticking Up the Smokes, which showed mothers who had given up the smokes during pregnancy and used them as ambassadors. And then the second phase was when their children are born. And so if you can see up there, there's the baby that was pregnant with in the other picture, through the eyes of children. Sharing some as well here. Yeah, we've got some resources there sharing some benefits of mum giving up the smokes. And so the newest thing is the release of a Facebook page to sort of try to capture a lot of this information and resources in the one place that can be shared. Yeah, no, did you want to talk about the Facebook a bit more?
No, that's fine.
That's fine.
Yeah, that's Facebook. It's a medium that we use to promote all the, the connections that we have in the community, to celebrate what they do and post photos, and then it's a two-way. Women are able to share the photos and promote the message and promote the program as well.
Yep.
In regards to what's new for AXA, AXA has a new CEO in Natana Davey, and Sarah's the new project officer. Like she said, unfortunately, this particular project is due to end in June. However, Sarah's made some really strong partnerships, so we're hoping that gatherings like this means that there's increased and continued investment into women and pregnancy and smoking.
So one of the partnerships we made was with the PepiPod project. So I'm not sure if you're all aware of the PepiPod project. It supports or promotes SIDS and also tries to reduce co-sleeping. So they get a pod, a lot of Aboriginal mums get a pod. It's a research project that Flinders University is doing. So we've done a video together to try to support each other in our messaging. And what they will do is that the mothers that they recruit, they will provide a pack of information that has all my details in it for the mum to contact me. And we also then share, as the AXA shares all about the partnership as well and recruitment process.
So we're running out of time, just go very quickly. The other aspects that are new, there's a new Sticking It Up the Smokes maternal health and smoking website, which can be accessible by the Bully Blasters TIS program website. So that's when you go onto Bully Blasters, that's what you'll be able to see. It's got information about the program over the last 19 years, information about ambassadors and resources. We've also recently finished and we started to introduce onto Bob flipchart resource for health professionals, which we've got an example here for you to look at later. Sarah's already spoken about the pregnancy information packs and distributed through PettyProd and also in other avenues. And we've also got a series of new resources which are also able to be viewed on the website.
Yeah. And with the pack, we'll just say we're trying to, we're going to add a little bit of a bib in there as well, but also to hopefully give to our Aboriginal health workers when they are running out of time or not too sure about next steps, provide that pack for mum to go and read when they're ready to have a read of it.
And the last slide is...
Okay, my next 4 months. So this is what I've got to achieve in the next 4 months. We are develop an Indigenous smoking in pregnancy action plan. So I suppose this sort of addresses some of the inconsistencies that we're seeing. So trying to put in a bit of a consistency plan and look at mapping what our member services are doing, and then also maybe what they should be doing in the one kind of plan to support, from the top level down to your health workers and GPs and clinical as well. We're going to look at ambassadors and refreshing that a little bit, because we have that has been proven to be successful if definitely done with a local lens. We're going, Marianne started a Smokerizer online educational project. So we have found that the Smokerizer is a very interesting and engaging tool for community to find. I think they see it as a bit of a tool. So, at events and stuff, they're really interested about what is this, little monitor tool thing. So they come up and have a yarn. So because of the benefits we've seen within our program, we're trying to create an online education program that we can give out to our health workers in supporting them to use the Smokerizer within their smoking cessation programs.
And just finally, one part of that is to encourage people to use it, is that we're going to be offering for a limited period. Sorry, Tom, is providing health services with the Smokerizer unit. So,
yeah.
Thank you. We can chat later.